Medical Foundation was founded in the late 80s, 1988 to be more specific. And at that time it was under the auspices of the Life Insurance Companies Association. And the body is an outreach project of the Insurance Association of Jamaica, but as I indicated before, now merged with the LICA and JAJ. However, numerous individuals have benefited from the foundation. Just to mention a few: the Heart Foundation of Jamaica, the Bustamante Hospital for Children, the Cornwall Regional Hospital, the Kingston Public Hospital.
I would like to call on Mr. Lloyd Vermont, our Honorary Secretary and Trustee of the Foundation, to present to Dr. Douglas a check in the amount of $250,000 from our association for the Kidney Support Foundation. Lloyd Vermont.
As a result of the prevalence of prostate cancer among Jamaican men, reputed to be the highest in the world, in 2007, the JMF linked with the Urological Society of Jamaica through its then president, Dr. Trevor Toller, and a march towards raising $10 million for the Urological Society of Jamaica to carry out prostate cancer research in collaboration with the University of the West Indies was undertaken. Dr. Toller continues to be the coordinator between the JMF and the Urological Society of Jamaica.
If it is as high as previously recorded, then we may want to invest further and to see if we can find out those factors which predispose our men to this disease.
At the JMF's fundraising banquet held in 2008, as a result of the tremendous work being done by urologists throughout Jamaica, 5 urologists were specially honored by the JMF: Dr. William D. Aiken, Dr. Claude Cadogan, Dr. Trevor Toller, Dr. Robert Wan, and Dr. Keith Weatherburn. The Foundation's 2009 fundraising banquet, at which 5 outstanding medical practitioners were honored, was again aimed at accumulating funds for the prostate cancer project. Vice Chancellor Nigel Harris.
Especially enthusiastic about the existence of the Jamaica Medical Foundation and its commitment to fund medical research. As you've heard, tonight's event being used to support prostate cancer research. I got to tell you that, as I listened to Dr. Richard Mayhew discuss the incidence of prostate cancer and this study that is going to happen in Jamaica, I felt, my God, maybe I better go back and put on my lab coat again. I'm missing the good days. But it's a fascinating study and very important, obviously, to get done.
At a recent prostate cancer seminar held by the JMF, Dr. Trevor Toller indicated that with the passage of time since the initial estimate was done in 2007, the prostate cancer research project will now cost in the region of $15 million. Funds for the project will be administered by the University of the West Indies, and implementation of the project will involve securing a coordinator, data collectors, quality assurance officer, administration, equipment, and other vitally important components to complete the project. So far, the JMF has already accumulated $2 million towards the prostate cancer research project and is desirous of partnering with companies to make this vitally important project come to fruition. The JMF and the Urological Society, along with the UWI, are desirous of having the project go smoothly once it commences. In effect, the JMF is requesting a contribution from your company to meet this $15 million target. A decision to partner with the JMF in this worthy project will allow your company to receive appropriate media coverage consistent with the size of your contribution. Special recognition at the Foundation's next fundraising banquet. A certificate of appreciation. Any other exposure that your company's PR executives consider necessary. Successful completion of this research will benefit all Jamaica. Prostate cancer impacts not only on individuals but also on families, businesses, and the nation as a whole. It must be remembered that many Jamaicans, some who were very prominent, have fallen to prostate cancer. Your company's financial assistance is needed to help fund this research, which will seek to identify why Jamaica is reputed to have this highest incidence of prostate cancer in the world, so that appropriate preventive care may be identified and practiced.